Across Lesotho's mountains and valleys, a movement was born. A movement driven by one belief that every child deserves protection from vaccine-preventable diseases. This is the story of the Lesotho Immunization Network. Network members were trained in immunization basics, equipping them with knowledge about vaccine-preventable diseases, routine immunization schedules, and the importance of timely vaccination.
For the longest time, as Charles existed, it has never really been instrumental in working directly with the CSOs to garner support for them to mobilize for the facilities. But with this new partnership that we are currently enjoying, Charles has been able to mentor us as child first to bring together the CSOs. Some of the CSOs were already in the health space. Others were really out, not anywhere near the health space. But what Charles did was to mentor us as child. We cannot just be depending on outside help. Let's rather build a platform whereby as Lesotho we know that we have a network where organizations can work together and support the facilities in the communities to ensure that immunization is done and no child is left behind.
Apart from child, we also have the child sister organization, which is CHAS from Zambia, and CHAS has been very grateful to the development of this network, because through CHAS and CHAL we are able to form the network. CHAS was there to take us through the election process of this network, and also while developing our advocacy strategy and some of the other documents, CHAS was in the forefront of assisting us in developing this document, because they even held a 5-day workshop for us in understanding how the advocacy strategy needs to be developed and what needs to be entailed in that advocacy strategy. Other than that, in order for us, because this is a first time Lesotho is going to have this kind of network, CHAS was kind enough last year in August to invite some of the board members to Zambia to go and experience firsthand how such a platform operates.
The establishment of the immunization network in Lesotho is important because it has created a situation or a condition in which civil society, government, and Christian Health Association of Lesotho can work together. Our partnership with CHAO is built on the premise that local organizations are best suited to understand and address the challenges that are facing their communities. CHAS was privileged in the last few years to work with CHAO as they led the implementation in Lesotho. We were privileged to facilitate this process in Lesotho. We worked with CHAO to make sure that they were mobilizing the civil society in Lesotho to work in the immunization and to establish the platform for immunization in Lesotho.
Across the project, thousands of children were identified, traced, and linked back to immunization services.
We have seen a great impact in the implementation of the engagement of the CSOs. And because the project was only implemented in selected facilities, we believe that extending it to other facilities would bring even better impact to this reaching every child, every community, so that we do not leave any child behind.
During this implementation, we have seen improvement in the data that we have received from the facilities. because the CSOs have been helping the facilities to update the registers, and that means the quality of our data improved very much.
But beyond the numbers lies something even more important: a stronger system, stronger partnerships, stronger communities.
The establishment of the Lesotho Immunization Network was a major milestone because it brought in all the CSOs that were working in the immunization space together. It meant that they were now approaching all the immunization issues in the country with one voice. For example, if they had issues at health facility level or at national level, they had one voice which they used to approach the different parties that were involved. And even for the application that they had to put up, they had to scan in the country what the issues were together and agree, and then come up with an application, which meant that they were no longer working in competition, but they were working jointly to see the children of Lesotho being immunized.
Going forward, what we see is that for this movement to grow and to continue to add value to the immunization program in Lesotho, to the children and future of Lesotho, what is needed is to really incorporate them in 6.0. The civil society organizations have done a brilliant job of really reflecting over the value that they can add to Gavi 6.0, and all that remains is to really take their input and include it in the 6.0 application for the country. And this is keeping with Gavi's 10% minimum allocation to CSOs.
One network, one mission, a healthier Lesotho for every child.